Hello, we hope you find this short film helpful prior to your fertility-related procedure at Ipswich Hospital. The aim of the film is to give you some information on what to expect before and after your procedure.
A hysterosalpingo is a test using ultrasound and a special fluid to examine the uterus and fallopian tubes, and we use this test as an infertility investigation. If either the cavity of the womb or the tubes are damaged, it can prevent conception taking place. It is not possible to see the tubes with normal X-rays or ultrasound, and so a specialist examination such as this is needed. The examination is performed in the ultrasound room. You will be asked to empty your bladder beforehand, and the procedure will be explained by the medical practitioner. You will be asked to lie on the bed, and a cover will be draped over your lower body. A transvaginal ultrasound examination will then be performed. This entails a thin ultrasound probe being introduced inside the vagina. This is a routine gynecological examination and should not hurt. This allows us to visualize the womb and the ovaries prior to the hysterosalpingo procedure. A speculum will be placed inside the vagina. This allows us to see the cervix or the entrance of the womb. A small catheter or a small tube will then be passed into the womb. A tiny balloon which is attached to the catheter will be inflated to keep it in place during the examination. The speculum is then gently removed and a small amount of fluid is injected into the womb cavity under ultrasound control. The fluid shows up as a bright white colour on the ultrasound, and we can trace its course outlining the cavity of the womb and tubes if there is no blockage. You may feel some discomfort similar to a period-like pains. A number of women may experience mild discomfort, and about 8 to 10% of them have mild to severe pain during the procedure. Immediately after the procedure, the same women refer to no pain or discomfort in about half of these cases, and less than 2% of them will still report mild pain after the procedure. Usually this discomfort is helped by using widely available painkillers such as paracetamol. If you are worried about the discomfort, you may take your usual painkiller half an hour before the examination. The procedure takes about 30 minutes.
You may not feel able to return to work immediately after the examination. If possible, you should be accompanied by a partner or friend on your homeward journey, and you should not drive for an hour or so afterwards. Most women feel completely well after the procedure and can return to their normal activities shortly after. The examination will be reported by the practitioner and we will be discussed in full at your next visit to the clinic.